Welcome to the Explainer. Today, we're going to tackle a topic that affects so many women but is often shrouded in mystery. We're going to demystify hyperandrogenism, and these slides are here to guide us through it all. So let me ask you, have you ever looked in the mirror and just felt completely frustrated by any of this? If you have, I want you to know you are so not alone, and actually, there might be a very specific biological reason for what's going on. That reason could be something called hyperandrogenism. Now, I know it's a big sciencey word, but at its core, it's really all about balance. It just means that the body has an excess of hormones called androgens. And while having some androgens is totally normal for women, having too much, well, that can cause the issues we just talked about. So in this explainer, we're going to walk through the entire journey together. We'll start with the symptoms, dive into the diagnosis process, and then explore the treatments that are out there. The whole goal here is to arm you with clear, science-backed info so you can feel way more empowered. Okay, so where do we even begin? Well, the first step is always recognizing the signs. Let's really dig into the key symptoms of this hormonal imbalance. The most common symptom by far is something called hirsutism. And listen, we're not just talking about any old hair growth here. This is specifically that coarse, dark hair that might show up in places like your face, chest, or back. And here's something that's super important to remember. Your personal experience is what truly matters. Sure, doctors have a clinical scoring system for this stuff, but if the hair growth is bothering you, then it's a valid concern. Full stop. Now, besides hirsutism, there are other common signs to look out for. Things like hair thinning on the top of your scalp, acne that just won't quit, and irregular periods, which usually means your cycles are really infrequent or maybe unusually light. So, what is actually happening inside the body to cause all of this? Let's take a closer look at the hormones that are playing a role in this delicate balancing act. The main androgen we're talking about is testosterone. And I know you probably hear testosterone and think it's just a male hormone, but it's actually essential for women's health too. It plays a really big role in ovarian function. But, just like a recipe, the balance has to be just right. Think of it like this. Your body has two little hormone factories. About a third of the testosterone you have is made directly by the ovaries. The rest of it gets converted from other hormones that are made in both the ovaries and the adrenal glands. Those little glands that sit right on top of your kidneys. Okay, so we know what's happening on a biochemical level. The next big question is, why? Why would the body suddenly kick into overdrive and start making too many of these androgens? Well, as you can see right here, the answer for most people is Polycystic Ovarian Syndrome, or PCOS. It accounts for a huge chunk of cases, up to 82%. That makes it the #1 cause and also one of the most common endocrine disorders for women of reproductive age. But, and this is a big but, age is a really critical factor here. Before menopause, PCOS and another condition called NCACH are the usual suspects. But after menopause, the focus totally shifts, and doctors start looking at other things, like ovarian hypertrichosis, or, in much rarer cases, androgen-producing tumors. So, how do doctors actually connect to all these dots, from your symptoms to a real diagnosis? Honestly, just knowing the process can make it all feel a whole lot less intimidating. The diagnostic process is basically a step-by-step investigation. As you can see, it all starts with a conversation, just talking about your symptoms and your history. Then comes a physical exam. After that, a simple blood test to check your testosterone levels is usually the next move. And sometimes, an ultrasound might be needed to get a better look at your ovaries. Now, the timeline of your symptoms is a major clue for your doctor. Gradual changes that happen over years, that often points towards PCOS, but a really sudden, rapid change that happens over just a few months, that can be a red flag for something more serious, like a tumor that needs to be checked out right away. So, to really help your doctor out, it's amazing if you can have this info ready. Things like your ethnicity can actually influence what's considered a normal hair pattern. The duration of your symptoms tells a story about the cause. And it's so important to mention every single medication and supplement you take because some things, like DHEA, can directly lead to excess androgens. All right, so once you have a diagnosis, the focus shifts to management. And the goal is always to address the specific symptoms that are a concern for you. For women who aren't trying to get pregnant, birth control pills are often the first line of defense. They work in a couple of different ways to help lower those androgen levels. Then, if that's not quite enough, after about 6 months, a medication like spironolactone might be added to the mix to directly block the effects of any leftover androgens. And here's something you really need to know. Hormonal treatments take time to work on hair growth. We're talking at least 6 months. That's why things like laser hair removal or waxing are often used right from the start. They're a really important part of the management plan. So when you look at all the options, medical therapies, local treatments, lifestyle changes, it becomes pretty clear there's no one-size-fits-all answer. The absolute best approach has to be tailored to your specific diagnosis, your symptoms, and your personal goals. At the end of the day, the journey to managing hyperandrogenism really starts with 2 simple things: knowledge and a conversation. We really hope this explainer has given you a solid foundation to understand what's happening in your body and to feel confident taking that first or maybe next step with your doctor.